Keeping blood sugar elevated for long periods leads to silent consequences that affect the entire body. Among the main reasons to lower it are preventing nerve damage, protecting blood vessels, and preserving metabolic function. When glucose circulates in excess, it overloads cells, tissues, and vital organs. For this reason, adopting effective strategies to reduce these levels is not just a temporary measure, but an essential action to avoid progressive complications that compromise energy, stamina, and internal balance. The first reason to lower blood sugar is to protect the cardiovascular system. High glucose levels cause chronic inflammation in the arteries, promoting vessel stiffening and increasing resistance to blood flow. Over time, this raises the risk of high blood pressure, heart attacks, and strokes. Controlling blood sugar helps keep arteries more flexible, reduces plaque buildup, and decreases strain on the heart, supporting healthier circulation and better oxygen delivery throughout the body. The second reason is related to preventing nerve damage. Elevated blood sugar directly affects nerves, especially in the extremities, leading to tingling, numbness, and loss of sensation. This happens because excess glucose damages nerve fibers and disrupts communication between the brain and the body. Lowering blood sugar helps preserve these neural connections, maintaining reflexes, coordination, and sensory function over time. The third reason involves weight control. When blood sugar remains high, the body releases large amounts of insulin, a hormone that promotes fat storage, particularly in the abdominal area. By lowering glucose levels, insulin secretion becomes more balanced, making it easier for the body to use fat as an energy source. This supports the reduction of visceral fat, improves metabolism, and lowers the risk of obesity and metabolic syndrome. The fourth reason to reduce blood sugar is to preserve kidney function. High glucose forces the kidneys to work harder to filter the blood, which can gradually damage the tiny blood vessels inside them. Over time, this constant strain compromises filtration capacity, leading to fluid retention and toxin buildup. Keeping blood sugar under control reduces this burden and helps protect long-term kidney health. The fifth reason is linked to stable energy and mental clarity. Frequent blood sugar spikes and crashes cause sudden fatigue, irritability, and difficulty concentrating. By lowering and stabilizing glucose levels, the brain receives a more consistent energy supply, improving focus, mental sharpness, and daily stamina. This balance also reduces cravings and episodes of overeating driven by sudden drops in blood sugar. The sixth reason involves strengthening the immune system. Excess blood sugar weakens immune responses, making it harder for the body to fight infections and slowing down healing processes. High glucose interferes with the activity of immune cells, increasing vulnerability to illness. Lowering blood sugar allows the immune system to function more efficiently, improving the body's ability to defend against viruses, bacteria, and chronic inflammation. The seventh reason is preventing insulin resistance. When blood sugar stays high too often, cells stop responding properly to insulin, requiring larger amounts of this hormone. This cycle leads to prediabetes and type 2 diabetes. Reducing glucose levels helps break this pattern, improves insulin sensitivity, and allows the body to use glucose more effectively and efficiently. Several simple strategies can support this process, such as walking after meals, improving sleep quality, reducing refined carbohydrates, and maintaining proper hydration. These habits help cells absorb glucose more efficiently and prevent sharp spikes. Small daily adjustments, when practiced consistently, create a meaningful impact on blood sugar control and overall metabolic health. In summary, lowering blood sugar is not just about lab results, but a decision that directly affects how the entire body functions. Protecting the heart, nerves, kidneys, metabolism, energy levels, immunity, and insulin sensitivity depends on this balance. Understanding these 7 reasons makes it clear that managing blood sugar is a fundamental step toward a more stable, functional life with fewer long-term health risks.